Stop what you're doing. If you receive SSI benefits, you need to hear this. In the next few minutes, your financial landscape for the entire month could change, and it's all happening this week. Welcome to your essential Social Security and SSI update, where we're tracking money, rule changes, and some major surprises you won't find on the official calendar. First, let's talk payments. Several deposit dates are scheduled to hit bank accounts over the next few days, but a specific calendar quirk means some recipients could be in for an unexpected bonus payment. Is it you? We've got the exact dates and details on who needs to be checking their accounts. But it's not just about money coming in. A brand new rule just went into effect that could impact your eligibility and monthly amount. Thousands could be at risk of breaking this rule without even knowing it, potentially jeopardizing their benefits. We'll break down exactly what this change is and how you can protect yourself immediately. And the surprises don't stop there. We've uncovered another critical update that could directly influence how much you receive moving forward. This isn't just another news story. This is a direct alert about your financial security. Don't get caught off guard. If staying informed and protecting your benefits is important to you, show your support right now by hitting that like button. It helps us continue to bring you these vital updates. All right, let's get straight into the details because your time is valuable and this information is critical. We promised to talk about payments, rules, and surprises, and we're going to tackle each one head-on, starting with the money that's scheduled to hit your account. Understanding the payment schedule is the first line of defense in managing your finances, and this week is a perfect example of why you need to pay close attention. For most of you on Supplemental Security Income, or SSI, you know the drill. Your payment is scheduled for the first of the month. It's the anchor of your financial planning. However, the calendar itself can sometimes throw a wrench in the works, or in this case, a potential blessing. This week we are approaching the end of the month, which sets the stage for one of these calendar quirks that can cause a lot of confusion, and for some, a lot of relief. Here's the situation we're looking at. The first day of the upcoming month falls on a Saturday. Now, the Social Security Administration, and the banking system in general, doesn't process payments on weekends or federal holidays. So what happens to your payment? The law requires that if a payment date lands on a non-business day, the payment must be sent out on the preceding business day. In this specific scenario, since the first is a Saturday, the closest prior business day is the Friday before it. This means that your SSI payment for the next month is actually going to be deposited into your bank account this Friday. This is the bonus, or double payment, that so many people talk about. You will have already received your regular payment for the current month at the beginning of this month, and now you're getting next month's payment at the very end of this month. It is absolutely crucial to understand that this is not extra money. It is not a bonus from the government. It is an early payment. This single check that you receive at the end of this month has to last you all the way through the next month until your following payment arrives at the start of the month after. This is where people get into trouble. They see a larger than usual balance in their checking account and think they've received a windfall. They might pay off a bigger chunk of a bill or make a purchase they've been putting off, not realizing they've just spent a portion of the money they need for next month's rent, utilities, and groceries. You must treat this early payment with extreme care and budget it accordingly. Think of it as receiving your paycheck a day or two early. The money still has to cover the same amount of time and the same expenses. This payment quirk affects everyone receiving SSI, so if that's you, mark your calendar and make a note on your budget. Your next deposit after this Friday won't be for another 4+ weeks, and you need to be financially prepared for that stretch. Now that we have the payment schedule clarified, let's move on to the second and arguably more impactful part of this week's update, the brand new rule that just went into effect. This is a significant change to the way the Social Security Administration calculates your monthly benefit, and it revolves around something called in-kind support and maintenance, or ISM. For years, ISM has been one of the most confusing and frustrating aspects of the SSI program. In simple terms, ISM is any food or shelter that you get for free or for less than its fair market value. The SSA has historically considered this a form of income, and as a result, they would reduce your monthly SSI payment. The logic was that if someone else was helping you pay for your basic needs, you didn't require as much financial support from the government. The most problematic part of this rule was how it treated food. Imagine an elderly parent living on their own, on a very tight SSI budget. Their adult child stops by every week with a bag of groceries to help out. Under the old rules, that simple, compassionate act of bringing food could be considered in-kind income. The SSA could assign a value to those groceries and subtract a portion of that value from the parent's SSI check. This created a terrible situation where people were effectively penalized for accepting help from their loved ones. It forced families into difficult conversations and made individuals choose between getting help and keeping their full, much-needed benefit amount. It was a rule that discouraged family and community support, which is the exact opposite of what a social safety net should do. Many people broke this rule without even realizing it, simply by accepting a home-cooked meal or a few items for their pantry, putting their benefits at risk. But as of this month, that has changed. The Social Security Administration has officially eliminated the food as ISM rule. This is a massive victory for SSI recipients and their families. That weekly bag of groceries from your child, it no longer counts against you. That community pantry you rely on to supplement your food budget, it no longer affects your SSI payment. The SSA has finally recognized that this policy was inequitable and created a barrier to food security for some of the nation's most vulnerable people. This new rule simplifies the process and, more importantly, it allows people to accept help with food without the fear of having their benefits cut. For individuals who were previously seeing their SSI checks reduced because of this rule, they should see their payment amounts increase. The SSA is in the process of recalculating benefits for those affected, but it's essential to be proactive. If you believe your benefits were reduced in the past due to food assistance, it would be wise to contact the SSA to ensure your file is reviewed under this new, more lenient policy. However, it's important to be crystal clear that this change only applies to food. The shelter portion of the in-kind support and maintenance rule is still very much in effect. This means if you are living in someone else's home, say with a friend or family member, and you are not paying your fair share of the rent, mortgage, and utilities, the SSA can still reduce your SSI payment. The maximum reduction is about 1/3 of your federal benefit rate. The SSA has complex formulas for determining what your fair share is, and it can get complicated quickly. This rental subsidy rule is now the primary way ISM will be calculated. So, while you can now freely accept help with food, you still need to be very careful about your living arrangements and how you document your contributions to household expenses. This rule change is a significant step in the right direction, but it doesn't eliminate ISM entirely. It simplifies one major, problematic component, which should bring relief to millions, but the complexities around shelter and housing costs remain a critical factor in determining your final payment amount. This brings us to the final piece of our update this week, the surprise that could influence your payments moving forward. This surprise centers on the annual cost of living adjustment, or COLA. Every year, the SSA adjusts benefit amounts to help them keep pace with inflation. The announcement of the exact percentage for next year is just around the corner, and that number will dictate the raise you see in your checks starting in January. While a raise is always welcome news, the surprise isn't the COLA itself, but the hidden consequences and the real-world impact that the headline number doesn't tell you. Based on the inflation data we've seen so far this year, analysts are projecting a COLA of around 3%. While that's lower than the historic raises we saw in the previous 2 years, it's still an increase. The first part of the surprise is how this seemingly modest raise can have unintended negative consequences. Many SSI recipients also rely on other needs-based programs like the Supplemental Nutrition Assistance Program, SNAP, Medicaid, and subsidized housing. These programs have their own strict income limits. The danger, often called the benefit cliff, is that your COLA-boosted SSI income could push you just over the income threshold for another vital program. You could find yourself in a situation where a $30 raise in your SSI payment makes you ineligible for $200 worth of SNAP benefits. you are left financially worse off despite the raise. This is a cruel irony of how these programs interact, and it's a surprise that hits many beneficiaries every single year. It's a critical reminder that your financial health is an ecosystem. A change in one area can have a ripple effect across the board. As the COLA is announced, it's imperative to check the income limits for any other assistance programs you use to see if you will be impacted. The second part of this surprise is the part of the equation that gets subtracted before the money ever reaches your bank account. For individuals who are on both SSI and Social Security Disability Insurance, SSDI, or retirement benefits, and are enrolled in Medicare, there's another factor at play: the Medicare Part B premium. The standard premium for Medicare Part B is automatically deducted from your Social Security benefits. And just like Social Security benefits, the Part B premium is also adjusted for inflation each year. It is almost certain that the Part B premium will increase next year. This means that a portion of your COLA raise will be immediately consumed by the higher premium cost. For example, if your benefits go up by $40, but your Medicare premium also goes up by $15, your net gain, the actual new money in your pocket, is only $25. This is a crucial detail that is often lost in the headlines about the COLA percentage. The real-world increase in your disposable income is almost always less than the official COLA figure suggests, and it's a surprise that can lead to disappointment and budget shortfalls if you're not prepared for it. Staying informed about these nuances is the key to true financial planning and avoiding these unwelcome shocks. Now let's peel back another layer of this onion, because the way the cost of living adjustment is calculated is a surprise in itself, and it explains why the annual raise often feels completely disconnected from your actual, real-world expenses. The COLA is not based on some general sense of the economy or a number that a politician picks out of a hat. It's tied to a specific metric: the Consumer Price Index for Urban Wage Earners and Clerical Workers, or CPIW. This index measures the average change over time in the prices paid by urban wage earners for a specific basket of consumer goods and services. The SSA looks at the CPIW data from the third quarter of the year, July, August, and September, and compares it to the same period from the previous year. The percentage increase becomes the COLA for the following year. The problem, and the hidden surprise for millions of seniors and individuals with disabilities, is that the spending habits of urban wage earners are often vastly different from the spending habits of Social Security beneficiaries. The CPIW's basket of goods gives significant weight to things like gasoline, transportation, and apparel. However, it gives less weight to the two categories that consume a massive portion of a retiree's or disabled person's budget: healthcare and housing. Medical costs have consistently outpaced general inflation for years, yet their smaller representation in the CPIW means those soaring costs are not fully reflected in the COLA. So when you get a 3% raise but your prescription drug copays, supplemental insurance premiums, and out-of-pocket medical expenses have gone up by 8 or 10%, you are falling further behind financially. It's a structural flaw in the system that advocates have been trying to change for years, pushing for the adoption of a different index, the CPIE for elderly, which would more accurately reflect the costs that seniors actually face. Until that change happens, the annual COLA will continue to feel like it's fighting yesterday's financial battles, leaving many people unprepared for the real costs of today. This fundamental disconnect between the official inflation measure and your personal inflation rate leads us directly into another major, ongoing issue that acts as a constant source of stress and a barrier to financial security: asset limits. For anyone on SSI, the number $2,000 is a source of constant anxiety. For a couple, it's $3,000. These are the limits on countable assets you can have to remain eligible for SSI benefits. Let that sink in for a moment. You are not allowed to have more than $2,000 to your name in savings, investments, or other countable resources. This rule is one of the biggest surprises to people new to the program, and it's one of the cruelest. These limits have not been updated by Congress since 1989. For over 3 decades, while the cost of everything has skyrocketed, this ceiling has remained locked in place. This creates what many rightly call a poverty trap. It makes it impossible to save for an emergency. What happens if your refrigerator breaks? A new one can easily cost over $1,000. What if your car, which you need for doctor's appointments, needs a major repair that costs $1,500? A single unexpected life event can force you to spend down your meager savings, leaving you with nothing or worse, push you over the asset limit, and jeopardize the very benefits you need to survive. It actively discourages saving and planning for the future. It forces people to live in a constant state of financial precarity, one unexpected bill away from disaster. While the new rule about food ISM is a step toward common sense, the asset limit remains a draconian and outdated policy that punishes fiscal prudence. There is growing bipartisan talk in Washington about the need to raise these limits, with some proposals suggesting figures like $10,000 for an individual, but as of this week, that is still just talk. The $2,000 limit is the law of the land, and it's a rule you have to navigate with extreme care. But in the midst of this restrictive landscape, there is a powerful tool, a surprise that is not well known enough, but can be an absolute game changer for those who are eligible. It's called an ABLE account. The Achieving a Better Life Experience Act created these special tax-advantaged savings accounts for individuals with disabilities. And here is the most important feature. The money saved in an ABLE account does not count against the SSI asset limit. This is your escape hatch from the $2,000 poverty trap. You can save up to $100,000 in an ABLE account without it affecting your SSI eligibility at all. This allows you, for the first time, to save for significant qualified disability expenses, things like education, housing, transportation, assistive technology, and healthcare, without the fear of losing your monthly benefits. Eligibility for an ABLE account is specific. The onset of your disability must have been before your 26th birthday. However, you don't have to have been diagnosed by that age. You just have to be able to prove the disability began before then. If you meet this criterion, you can open an account and you, your family, and your friends can contribute to it. The money grows tax-free and can be withdrawn tax-free for those qualified expenses. This is arguably one of the most significant developments in disability law in the last generation, yet a surprising number of eligible individuals and their families have never heard of it. Spreading the word about ABLE accounts is a critical mission because it provides a pathway to financial stability and independence that the standard SSI rules simply do not allow. If you think you might be eligible, you owe it to yourself to look into your state's ABLE program this week. It could fundamentally change your financial future and provide a level of security you thought was impossible to achieve. This is more than just an update. It's a lifeline. Navigating the world of SSI requires you to know not just the restrictive rules, but also the powerful exceptions that have been carved out to help you build a better life. So, as we wrap up this week's essential update, let's quickly recap what this all means for you. We've seen how a simple calendar quirk is bringing your SSI payment early, a welcome sight but one that demands careful and disciplined budgeting to make it last the entire month. We've celebrated a major common-sense victory with the elimination of the food rule in ISM calculations, finally allowing families and communities to support each other without fear of penalizing their loved ones. And we've looked ahead at the approaching COLA announcement, understanding that the headline number is only half the story, with rising Medicare premiums and an inflation index that doesn't truly reflect your costs poised to take a bite out of that raise. We've also confronted the harsh reality of the decades-old, punishingly low asset limits that trap so many in a state of financial anxiety. But we didn't end on a low note. We highlighted the incredible, game-changing power of ABLE accounts, a vital tool that offers a real pathway to saving, planning, and building a more secure financial future beyond that restrictive $2,000 ceiling. The world of Social Security and SSI is a complex web of rules, dates, and numbers. It can feel overwhelming, but it is not unmanageable. By staying informed, by understanding not just the challenges, but also the solutions and opportunities, you shift from being a passive recipient to the active CEO of your own financial life. You are in control. If this breakdown helped you connect the dots and feel more prepared for what's ahead, please don't let that knowledge stop with you. Share this video with a friend, a family member, or a neighbor, anyone who relies on these benefits. A simple share can prevent a budget crisis, uncover a new opportunity like an ABLE account, or simply provide peace of mind. Thank you for making it a priority to stay informed. Stay vigilant, stay empowered, and we'll see you for the next critical update.